Hello, hello there. My name is Grace Godfrey. I am a pastor by profession for the last 14 years when I started or when I planted the first church. I work with an organization called Free Pentecostal Fellowship in Kenya, and I have planted like 5 churches that are still existing and growing, and I thank God for that. I am also a founder of Grace Sufficient International or Grace Sufficient Organization. I have registered it here in the US as Grace Sufficient International. That's why you see the logo. No, the logo is Sufficient Organization. And so I have also registered one here, Grace Sufficient International. But the one in Kenya is Grace Sufficient Organization. And how I started this ministry, I started this ministry by a need. There was a need and a pressing need that made me start working for people who are HIV and HIV positive. And so I made a decision to be able to talk to the ailing community. And I started by inviting one lady in the church. And when I invited her, she said, I don't come to church anymore. I am sorry. And I wanted to know the reasons why. As a pastor, I needed to know. And so she told me, I've been going to such church, and then I am HIV positive with my sister. And then we were stigmatized, discriminated, that we did not see the need of going back to the church. And so I felt moved to get to know these people and to get to know what they are going through. I asked her, are you able to bring these people, a few people who can be able to just come and be public that they are HIV positive? And so she brought me a group of 50 people who are HIV positive, and we started by trainings and providing love, showing them that someone cares, not all people that can discriminate. So I started by showing them my care, and my congregation will be caring, and we need them equipped with the word of God. Our client segments are the HIV victims. I usually call them pillars. And the orphans. When you mention HIV, you know you have to have kids who are HIV. Actually, we have some kids who are HIV by birth. And we have also kids with special needs. We have elderly. These are the grandmothers that have been left with these kids after the young mothers die, or the young dads, or the young parents, and they are left with the kids. And also families and friends of the victims, they also suffer, and they also need some trainings how to handle the situations, and even how to help the victims of HIV and AIDS when they get ill, how to take care of them. And so those are our victims and our client victims segments. And the donor segment, we have currently the current and potential donors, business owners, church organizations, non-profit organizations, friends, others who have heard about us, and even the friends and the families of the victims. And we work with everyone who is ready to work with us and who is frontiering to be part of Grace Sufficient Organization. Otherwise, it is a great challenge, even in the community, for all of us who are not HIV positive. It is a challenge to work with these people. It is a risk, but we take it on ourselves that we are not going to get infected, especially when we get together. You cannot get infected because of hugging them, interacting with them, until or unless you use a sharp object or you have sex unprotected. Those are the few things that make people get infections. I know we know all about this, but it is always good to remember. This is a group of like 150 last Christmas of 2021 on the date 12th or 13th of December. And so the front line were kids, small children who are HIV positive, and some of them are orphans, and the rest of the communities are mothers. You see, women are so many in this picture. And so this is just one group of people. And I have families that are HIV positive. Just sorry to mention that. The lady who is on the right in the picture is my little sister. She's young, younger than I, and she's HIV positive. And we lost her husband a few years ago from HIV positive, but she stays positive. And I always encourage her to stay positive and positive, positive, positive. That's how we work with them. You are positive with HIV and AIDS, but stay positive and do positive things and talk positive, and things are going to turn around. So she's my sister, blood sister. I have also lost my brother-in-law last year, and the wife is not HIV positive, who is my sister. Because of the training that we offer, she is actually in this picture, and she is the financial officer. The husband was HIV positive for more than 25 years. He just died last year from COVID, and my sister did not get the HIV positive. I don't know what to say, but the training that we offer, encouragement that we offer, she was able to live negative. It is all about listening and following instructions. And I also lost my sister-in-law, a lady that was married to my brother. And interestingly, my brother wasn't HIV positive. He was negative. So anything is possible so long as you are doing the right things. So HIV is not something to just to keep people away, to stigmatize them, discriminate them. You can live positive for long time or many years. That's why we have them, so that we can help them overcome the challenges and the stigma. And having them, this is our most difficult case in our organization. Lydia is a good example of the pillars. She said that we give her hope. Her son, Alfred, was 7 years and HIV positive from birth. Alfred used to come to church when we had overnight prayers at age 7. He asked for healing prayers. We prayed for him. He got healed, but over a longer period of time. He is HIV free. Today he's a worship leader and very anointed in leading worship. Radia says that she will live to see her son walk down the aisle. She is not dying till that happened. She says that we gave her son life, and we have given her hope to see the dream come true. This is the most difficult case that we ever had in our GSO, especially of a mother who has been on bed since Alfred was 7 until now he is over 25. So, and we hope that God is going to help Alfred get to where the mother wants him to be, to walk down the aisle and to be able to see the future. We went to visit her. I usually go there all the time. I'm right there sitting next to her bed with some Christmas giftings so that she can also enjoy like any other person. These are the kids. Some of them are HIV positive, and on the right is a pastor who preached to them. He has been my colleague for many years, maybe like 30 years, since we were members of the church before we were ordained as pastors. And those are the kids that came to our event on Christmas. So these kids on microphone, they told me, Pastor Grace, we just need food. If you can give us food, will be good. It goes a day without knowing where the next meal is coming from. And even about the school, we need school fees. We need people who can help us. If you look at those girls, they are adults, they are teenagers, and at a certain age, maybe from 13 years of age, the girls start the monthly cycle and they start having periods. And these kids, they told me or us that sometimes they miss classes for a week if the periods are on the process, that they miss a week for school because they don't have enough protections. So it is a hard thing even to imagine. You just imagine, my listener, you just imagine your daughter without sanitary towels. How would that be? It is very embarrassing, very humiliating, and remembering, if I had a mother, this would never happen to me. If I had a dad, this would never happen to me. So I am requesting all of us, and I'm talking to the world, that just give a kid a chance to be able to become a woman and be ready for a womanhood and a motherhood, because they are growing to be mothers. So let's give to these kids, especially the sanitary towels, and help them go through it. So we do this, and I'm requesting even my board members to be able to foster these kids at any level, even at the level of taking them, a child or two child, out on a weekend with your children. It can change a life. These are kids with a future. These kids can be doctors, they can be educators, they can be engineers. Last year we sat with them and talked with them about what would you want to be when you grow up. They said, I want to be a teacher, I want to be a professor, I want to be an engineer, I want to be a nurse. So we can only help these kids to become what they want by the grace of God. This is some of the activities. We train the pillars in their support groups on living positive, but positive with attitude. It requires professional trainers. We train on capacity building and adherence to medication. We need professionals such as doctors, nurses, nutritionists, and life coaches. They need to get paid to be able to do this. GSO help pillars extend their lives and hope. We had positive outcomes for the last 10 years, just giving them hope so that they can face a day at a time. These are the mothers or grandmothers. So they live in the slums. So this picture is in 2008. I have trained my children to be able to give someone before they have Christmas, and that has been our custom and our tradition. So we usually go and give people food before we have our Christmas. This was on the eve of Christmas. So we went to the slums, we cooked food, and we went to the slums. This is part of one of the group that we met. So when young parents die of HIV, they leave young kids who need care, food, education, and love and life necessities. These kids need a family like yours and mine. They need to relate with other kids, mother, father figures. We encourage child fostering of any level. And I like this verse because it led me. This is the verse that started working in me when I started helping the people. This is Proverbs 19:17. Whoever is kind to the poor leads to the Lord, and he will reward them for what they have done. Our vision. Our vision, GSO vision, is to eradicate poverty, add value into the society of pillars, urban and kids with special needs, most less fortunate in extreme poverty, and to fight stigma and discrimination, to assist in access to adequate health care. We do this by trainings on financial freedom, providing the basic needs, providing education to the orphans, sensitizing the rest of the community to stay negative, and regular testing so that we can reduce the infections of HIV and AIDS. We do this in support groups, peer mentorship, community interactions, community sensitization and counseling, and we are planning for a community resource center and youth training technical center. Why we want to do the youth training technical center? It is because these kids, after they are 18, they are supposed to leave the home, the orphanage and live on their own. So if we are able to have a youth training center, training them on skills, these young people can make a life of their own on their own if they are not admitted to the university. Value proportions, client, food, water, clothing, shelter, and of course the spiritual needs, emotional and the like. Access to adequate health care, advocate against stigma, discrimination, eliminate poverty, human capacity building, spiritual, emotional, and physical care. For the donors, we need them to assist in food, staff donations, show love and support to the client segments, availing themselves in the event we need them and involve them, integrating the clients in their event to be part of a larger families or communities, and mostly offering jobs, opportunities to the client. It doesn't matter what kind of a job you're having, but we can always work with anyone with any kind of job they have. Our external and internal stakeholders, donor segment, current, prospect, future donors, client segment, and their friends and families of friends and friends of and strangers. Client segment, current, prospect, future. No, I made a mistake. I'm sorry. I apologize. Let me go to the founder director. The founder director of GSO, the board members, partners, volunteers, and influencers, as well as the client segment, as they are motivational factors for us to influence. The client profile is of poor background, physically weak and ill from the virus, the lowest profile to be found in any human race. We deal with the poor families who are not sure where the next meal will be showing up and from who and where. We are developing a medium profile of donors to start with before we raise to reach out to the high profile, as it is easier to reach those close to your profile first. So right now we have the medium profile and we are hoping for the high profile. The strategies: we are going to visit churches, church gatherings, brochures and business cards, campaigning on the street and cities, peaceful demonstration. We have had one before, as we put an awareness, as we claim our rights from the healthy people, those who think they are healthy, as they think that our clients need to be respected. We wear t-shirts that read our rights now and here. This was our first public meeting in the street to go public, that we are pillars. Personally, I'm not, but I find identity with the victim as I am encourage them to feel loved. Key activities, key resources, and structure. I will assign delegate responsible to the qualifying individuals, professional to manage and oversee. Key resources will be church organization, political parties, politicians, the successful non-profit organizations, my listener and their friends, their colleagues, healthy department, Ministry of Education through bursaries and student aids, grocery store for food and back to school supplies. GSO activities. GSO will hire social worker to manage social activities for the client, social interaction, training on financial freedom to reduce family poverty, youth career training, spiritual sessions to all client segment, mentorship program, constructions of the community resource center, youth polytechnic training center, low-cost healthy clinic, and the cost structure, building constructions, cost for the centers, like 700,000. Sorry, I made a mistake. Accessories for equipment, 200,000. Unseen expenses, 100,000. 200,000, 100,000. We expect to reach milestone We expect to reach this milestone, whichever may we get there, either by donation or by kind gift, including frontiered manpower labor. By date, to date, 5,000 or even available, 10,000 by 2022, December of this year, first shipment. 1,000 by August 2022, second shipment. $100,000 by December 2022, first revenue. $2,100 by June 2023, second revenue. $200,000 by December 2023. Successful stories. Here is John Moshera and the wife. They met in a support group meeting where they felt attracted to each other. They decided to get married. We counseled them as our client who want to enjoy family like any other family. After a short while, they got married and had two beautiful kids who are HIV free. James Gedua has a similar story. He married a positive lady. After GSO advice and counseling, they were blessed with beautiful baby girl free from HIV now over 5 years ago when I saw her last. Rebecca is here testified that since GSO came in their lives, no death from HIV has happened. We are talking about over 10 years. The fourth testimony is from Isaac. The first orphan of GSO is completing his doctorate degree actually here in the US in Texas University. He's doing civil engineering. Isaac desires to support other orphans after completion. The more we support orphans, the more they will be supportive to others to reduce poverty and to reduce HIV infections spread, because they are originally from poverty. Oh, we are committed members. We have committed members of the board delivering services for free to the clients. The board members have been on the ground changing the lives of communities. They have been working and walking with the pillars for the last over 10 years with no sign of slowing down. Okay. These are the board GSO organizational structure. Grace, founder, director. Pastor Timothy Gashoki, over 10 years of management. Reverend Mary, over 10 years of CEO, GSO. Daniel is an anointed man of God who preaches in our occasions. All of them, he always have a word for the people. He is a blessing to us. Anthony Karaoke, my son, co-founder and GSO graphic designer. Julia, daughter-in-law, the wife to Anthony, children ministry director over 10 years, even before she got married to my son. Salome Karaoke, daughter, administrator over 10 years. Diko Sahu, son-in-law, nutrition specialist and hygiene for 8 years. Martin Getao, my son, logistic coordinator and internal auditor. And Rebecca, daughter-in-law, is an orphan feeding program administrator. She is married to my son, Martin. David Kamau, my son, GSO resource mobilizer. Peter Kemanga is a senior person in the government. He is event manager over 10 years. Cephas Bolo is the support group coordinator over 10 years. Executive Officer Timothy, Chief Operating Officer Martin, Chief of Financial Officer Mary, Chief Managing Officer Salome, Chief Technology Officer Anton, President Grace Godfrey, Vice President Anthony, Executive Assistant Salome. Thank you, thank you, thank you, thank you, note to my structural team. Thank you for all taking your time to listen to my BMC pitch presentation by Grace Godfrey. Bye-bye.